Welcome to this special edition of AQMD's On the Air. I'm Sam Atwood, spokesman for the AQMD, Southern California's Air Pollution Control Agency. Understandably, reports about harmful radiation escaping from damaged nuclear power plants in Japan are of concern to everyone. We have been closely tracking radiation levels at 3 sites in Southern California and sending these measurements every hour to the U.S. Environmental Protection Agency. With us today is Dr. Jonathan Fielding, Director of the Los Angeles County Department of Public Health and the County Health Officer. Dr. Fielding is responsible for all public health functions, including surveillance and control of both communicable and non-communicable diseases, and the health protection of the county's 10 million residents. Dr. Fielding, thank you for joining us.
You're welcome.
What potential risk does the Japanese nuclear power plant disaster pose for Southern California residents?
Well, at this time, based on what we know today, there is not a significant risk of harmful radiation that would come to Southern California. So it's understandable that people are concerned. Some people have gone out and bought potassium iodide and done other things. But based on what we know at the moment, there is not a significant risk. That could change over time, and if so, we will have plenty of warning and there'll be plenty of communication to the public. But at this point, there is no increased risk, and our level of radiation right now, if people want to know, is just background level, just exactly what you would expect.
What radiation levels are we being exposed to, and what are natural background radiation levels?
We're all exposed to radiation all the time. The background level is about 10 to 12 microrems per hour. And there are a lot of things that affect it. For example, if you go on a plane, you increase your exposure to radiation. The kind of radiation that would cause concern is many, many times greater than that. And at this point, there's no increase above the background level. There is extensive monitoring going on of the air by AQMD and by us and by national and state organizations, agencies. We're going to also be looking, of course, at water and food if, in fact, that becomes an issue. So the monitoring, I've never seen more monitoring going on worldwide. So there's plenty of, there's no question that if there's any increase anywhere, it's going to be known immediately.
How will residents be informed if a threat does exist?
Well, if a threat exists, we would work with other local, state, and federal agencies to provide accurate information to the public about everything that we know. And if there were any precautions that need to be taken, we would certainly let people know that. But I want to reiterate at this point, there's no information suggesting there's an increased risk to California. And if that changes, we would certainly let people know as soon as we know. And because there's monitoring all the time and these instruments are exquisitely sensitive, we'll know very, very quickly. The most important thing anybody can do is to prepare for all emergencies. We know that we're going to have a large earthquake. We don't know exactly when. We've had mudslides, we've had fires, and we've had a small tsunami. There are a number of things that can happen. We want to be prepared for all of those. So what everybody can do is to make sure they and their family are prepared by having a family communication plan. How will you reach loved ones in the event of any emergency? If the phones go down, what do you do? Where do you meet? What about kids in school? All those things. Secondly, you want to have a family emergency kit, and you want to have one at home, you want to have one in your car, you want to have one at work, and there are about 10 things that you want to put in there, and you can find exactly what those should be at the website indicated on your screen right now. And it's really important to have all those in the event of any emergencies. Water, food, cash and important documents, clothing, flashlight, first aid kit, prescription medication, a radio that operates on batteries is important, toiletries, and tools. Particularly important is to make sure if you're on prescription medicines that you have some extra supply, because it may be difficult to get those in short term, and for many people those could be extremely important. So if we do those and then we listen to what the public officials are saying, that's the best way that we can all be prepared for any emergency.
Dr. Fielding, thank you for joining us, and thank you for your passion and commitment to protecting the public health of all residents of Los Angeles County.
You're welcome. Thank you very much for having me.
Thank you for watching this special edition of AQMD on the Air. For more information on AQMD's monitoring of radiation levels, as well as the many other AQMD activities designed to protect public health and how you can help clean the air, please visit us at www.aqmd.gov.